This is Boomer Life on CIL 650.
This is George Gordon, Boomer Life on CIL 650. We're talking to the good folks, naturopathic physicians, Dr. Eric Posen and Dr. Larry Chan from the Naturopathic Medical Center. We're talking about aging well, and some fascinating discussion that we had just in our last segment about aging. We're not talking about old people necessarily. We're talking about young people who may be old people inside because they haven't had the right kind of help. So let's talk about the oxidative therapies. Let's help me understand oxidative therapies.
Sure. I know it can be very confusing in the use of the words because a lot of words seem to be interchangeable. First word, oxygen. That's pretty easy.
Right.
We all know that one from day one. But that's the most critical nutrient any of us can ever be exposed to. Without it, it's all over. So any therapy worth its weight has to help your body utilize oxygen, because we all have access to it. It's how you use it. And the whole process of aging ends up compromising your ability to utilize oxygen. What's one of the ways that happens? Through a process called oxidation. Well, when we take nutrient in through what we eat, drink, and breathe, we use oxygen to break those substances down to produce energy. If you all remember your high school biology, the words mitochondria, oxidative phosphorylation, Krebs cycle, ATP. I see some of the lights turning on in your eye there.
That's the only subject I did well in.
Well, all those things really are true. They actually do happen in our body. And how well all that is working will determine how well you can burn these foodstuffs, primarily fats, into energy. As we get older, the ability to do that can be compromised. And why is one of the most common complaints we see in our office, such as weight problems, an issue? That's compromised ability to turn fat into energy. What does that come from? Poor utilization of oxygen. So that's an oxidative issue. Then there is something called oxidative stress. What's that? Well, once cells in the body are exposed to oxygen to go through this process of energy production, there's a liberation of many things called free radicals. And free radicals are useful in the body. Our body needs them. That's where nitrous oxide and superoxide dismutase come in and help our bodies utilize oxygen. But we need to be able to have a buffer to break those things back down to water. Because if they don't, those things are going to produce oxidative stress, which means they are going to bind to parts of our body, the chemicals that we normally use, like proteins and fats and things like that, and make them unusable. And then they just sit around and accumulate, and that's where the fat comes from, to some degree.
I thought it was just beer when I was 18 years old.
That's a slippery slope.
It is. It is indeed. Well, that's a good explanation, and perhaps helps us understand why more advertising and marketing, they'll talk about foods with oxidative powers and deals with free radicals and stuff. And marketers are very good at grabbing little words and making them sound like their cereal will or whatever will solve all problems, but that's only one step, right? So let's talk about the patient coming through the door at the center. And if you've got any examples, I'd love to hear about them. You talked about the listening process. You talk about helping them understand, letting them hear the words coming from their, as they talk about their life story and maybe some of the problems. What's the next step then when you take a young person who may not understand what's happening to them, as opposed to somebody who's 60 who doesn't want to feel like 80, but doesn't understand or just knows that they have to get some answers. Help me out there. How do you deal with that?
I think I'm giving an example, and Eric can talk a little bit about what we do in our clinic about that, but an example of just how do you work with a patient that comes in that may present a myriad of problems that we can plug into. I had a patient come in. He was in his early 30s, well, maybe mid 30s, and he'd come in. He had literally died a year earlier, or 2 years earlier. He was walking the street, standing at a stoplight, fell down, his heart stopped. Lucky for him, CPR worked. A passerby did CPR, revived him. He went to hospital, and he was actually suffering very little damage. Turned out that he had a coronary artery that was congenitally. He was born with a narrow coronary artery. That was the main one. So it basically just blocked up on him in a spasm, and he actually just stopped. His heart stopped momentarily. But he came to see me not because he was having problems with that, because he was on a whack of pills. He was given so many medical drugs for blood pressure, for cholesterol, for all the kind of risk factors that one has. He was given maybe a fistful of pills every day because he was now a cardiac patient. Well, in reality, none of those things existed. He didn't have any problems with any of those issues, except he had this congenital defect. So he said to me, I'm feeling so bad now. I'm on all these medications. I can't exercise. I'm tired all the time. I'm feeling just horrible, depressed. Can you help me get off this medication? So, as Eric would know, my partner here, you can't just take people off medication. You have to go back to their doctor and say, how can we have a relationship with him to take them off responsibly? So we did this process over the course of the next year, where we actually got him on alternative things and had him go back to his doctor and get them to sign off on certain things. And after about 8 months of this, he was able to go off all the medications, and we gave him a better healthy lifestyle choices, better diets for our nutrition department. We helped him with structural problems that he may have had in the spine. We helped him just to get on a good exercise regime. So that's kind of how we worked with this individual to get him back on his feet. So that's not a typical patient, but that's one that we utilize all the services we have in our office to take care of this individual by listening to his story. Because otherwise, we would just send him away saying, you're on the medication, go away. Well, medically, he was on a protocol that was actually not right for him at that point in time.
Yeah. And actually, what you say is really important, because there's a lot of medication out there. Some antibiotics like Cipro, statins, which a large number of people are on, aspirin.
Okay.
As an example,
Pretty common.
which is pretty common, especially in the people perhaps listening to the show. All of which have shown that they compromise the ability of cells to utilize oxygen at the level of the mitochondria.
And yet we hear, if you think you're having a heart attack, take a couple of baby aspirin and
Rightly so. I mean, there is valid use for all these
Okay.
medicines, but it has to be weighed against many other factors. How much compromise is a long-term use of aspirin going to make in someone who you're just seeing it as at a preventative level, but actually as a preventative level is overall compromising their ability to be vital, and is going to fatigue their system, and is going to push their body not into being able to utilize oxygen so well for energy production, but actually pushing them more into something called anaerobic metabolism. What's anaerobic metabolism? That's where you get energy from fermenting sugars, from the breakdown of fats, or rather sugars through another system, which adds far more garbage as byproducts into your body that your liver, kidneys, lungs, etc. have to get rid of. So actually, in some ways, some of these medicines are aging you faster.
So the example of the aspirin for short-term use, such as an acute stage, if you feel like you have a heart attack or shortness of breath, yeah, pop the aspirins, because they can really help keep the vessels open. But that's very different than using it on a daily basis for the next 20 years, because that's where you can really interrupt the oxygen utilization and start aging your cells faster.
well, that's a critical point. I think that we should spend a little bit of time on here. And you've talked about, I call them the big three. If you're discovered to be a diabetic, usually that comes in tune with cholesterol and often high blood pressure. So you're on, if you're lucky, it's glyburide or metformin,
which is another mitochondrial compromiser.
Okay, and then you're on a statin drug for another one, and then something for your blood pressure, and that is very common to have that trio of drugs, and a lot of guys I know my age that are on that regimen. What is that doing to them? What are the alternatives?
That's a really good point, because if just taking medicines is not going to do much. It's going to be helpful. It'll reduce some risk factors, but it's also setting you up for problems further down in your life that have already been at work to produce the problems you're experiencing, such as the diabetes, the hypertension, and atherosclerosis. Those are all diseases of aging. So most of the therapies that are going to be effective, well, let me back up. Because every one of those issues has to do with your whole life, right?
Okay.
So there are three aspects to our lives in which our bodies try to heal ourselves and resolve issues. One's nutritionally, how well we take nutrient in, process it for energy, and get rid of the garbage. Another is mechanically. Do our bodies move with fluidity and grace? Are they able to make all the systems in our body move accordingly? Like, for instance, a large amount of your guts, the movement in your guts is dependent on exercise. Exercise is critical for your body's ability to utilize oxygen. It's the only thing outside of being in the fetal experience that makes more mitochondria. So there's probably the simplest answer for many things. And the third part and way in which we try to heal ourselves and can get into issues has to do with what's called the energetic aspect of our life, the mind-body experience. You know, we were talking before about what happens in your mind and what happens in your body. So if you're in a job or a relationship that basically is you are giving up your power on a daily basis, where you are taking somebody else's wills and desires and taking them as your own, as opposed to doing what it is that you want to do in your life, and you're living with resentment, frustration, rage, what's that going to do to you? It's going to change every cell in your body, and it is also going to compromise your ability to utilize oxygen at the mitochondrial level.
Talking with the good folks from the Integrative Naturopathic Medical Center here in Vancouver today, physicians Dr. Eric Poulsen, other naturopathic expert Dr. Larry Chan. We're talking about the aging process and aging better. Some of the things that you can do for yourself, some of the new studies that have come out, some of the practices. We'll get into hyperbaric oxygen therapy and ozone therapy coming up in our next segment. It's a fascinating discussion, and if you would like a little more information, perhaps you want to call the center and set up a consultation. You can go to integrative.ca, and there's lots of information on there. We're going to be right back on Boomer Life on CIL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CIL 650.